Hello, my name is Dr. Shane Arnold with Airrosti. Today we're going to be talking about hip flexor injuries. We'll discuss the causes of hip flexor injuries. We'll also talk about the signs and symptoms. We'll discuss how traditional medicine approaches hip flexor injuries and how Airrosti is a little bit different. Let's get started. So a hip flexor injury is when the muscles that help to flex the hip become torn, damaged, or inflamed. The specific muscles we're talking about are the psoas and iliacus muscles, which run from the upper thigh deep through the abdomen to attach to the low back. Now let's discuss some of the causes of hip flexor injuries. Causes of hip flexor injuries include direct trauma, not warming up or stretching properly, or overuse of the hip flexor muscles, especially in athletes who participate in cycling, swimming, and running, or people who do lots of kicking, jumping, or squatting. These muscles become injured especially when there is restricted motion to the hips and or weakness in the pelvic muscles, including the glutes, which help us to move and provide stability. Now let's discuss some of the signs and symptoms of hip flexor injuries. People with hip flexor injuries will often have sharp pain in the front of the hip or groin. They'll also feel pulling or tightness in the same area. Often they have difficulty walking, climbing stairs, or pulling their leg up, such as when they try to put on their socks. Additionally, there can be visible swelling or bruising in the same area. Now let's discuss how traditional healthcare usually handles hip flexor injuries. With mild cases, they might prescribe rest, ice, or the use of anti-inflammatory medications. Physical therapy might also be prescribed, and in severe cases, sometimes surgery is recommended. Now let's talk about how Airrosti is a little bit different. The Airrosti visit starts with a thorough evaluation which helps us to arrive at a proper diagnosis so that we can get to the root cause of your pain. Our focus at Airrosti is fixing the connective tissue and manually repairing it to its normal state, either through hands-on manual therapy in clinic or through provider-guided self-myofascial release for our Airrosti Remote Recovery patients. We follow this up with an active care program with specific stretches and exercises you can do at home to help increase the strength, function, and range of motion. This will help you to quickly return to normal activity. We hope that the information presented was helpful to you. Now, if you or anyone you know is suffering from hip flexor injuries, reach out to Airrosti. We'd love to help you. To schedule an appointment, simply click here. We have both in-clinic and telehealth options. If you'd like to check out any of our other videos, click up here and don't forget to subscribe to our channel. See you next time.